At Southeastern Health, one of our value statements is that we pursue positive change. Most of us in our lives really don't like a lot of change, do we? It's difficult sometimes when change is put upon us. But I would submit to you tonight that the people that are sitting in this section over here as nominees for tonight have pursued positive change. And through that positive change, they have made a huge difference in our community. And for each of us that are citizens of Robeson County and the surrounding area. It's our privilege as the healthcare institution for this area to recognize those people that are really trying to make a difference in the lives of this community. And we want to take tonight as just a pause to say thank you for doing that. But I have the executive team with me tonight. They're going to help with the distribution of the awards. But those of you that are not in the nominee section, I want you to sit back and listen to the stories of what each of these people have done, either individually or through their groups. Because they are what's helping Robeson County be a better place to live through the pursuit of positive change. For that, I'm going to turn the evening over to Lakeisha Hammonds, who's the director of our community services. Lakeisha?
Good evening. And again, welcome to our 2017 Regional Community Health Awards. Tonight we celebrate the leaders of health and wellness in our region who have set exemplary examples toward improving the health of our community. This is the 5th year of Southeastern Health's Regional Community Health Awards. It's the 3rd year that we've been regional, but this is 5 years that we've had a total event. As you enter the auditorium, you may have noticed a slideshow of past winners and nominees from 2013 to 2016. If there are any of our previous award winners and Compassion for You churches and partners that are in the audience, would you please stand at this time? Nominees and winners from 9 categories that are equally impressive as our previous winners and nominees. The categories in which we will be recognizing are faith-based, business, community education and emergency support, government, healthcare providers, individual impact, along with 3 distinguished awards, which are our Lifetime Achievement, Lifetime Commitment, and our Beacon of Hope. Additionally, there will be recognition for individuals and groups nominated for going above and beyond the call of duty in the wake of Hurricane Matthew. There will also be special recognition for our Compassion for You Congregational Wellness Network, Covenant Churches and Partners. Your program booklet contains detailed information for the reason for each nomination. As the category is called, we would like to ask nominees for the said categories to join us on stage. As your name is called, we would ask that you please step forward as you're recognized. To us, all of you are winners. However, there will be 1 winner selected from each category and honorable mentions. There will be overall recognition for nominees within the Eye of the Storm, Lifetime, Beacon of Hope, and Compassion for You Churches and Partners categories. We would like to ask all honorees and winners from each category to please report to our side area for a group photo. So will you please return to the auditorium after your photo is taken. So once you come up on stage, you're going to exit out. There will be someone that's escorting you to show you where your photo will be taken. At the end of the event, we would also like a group photo for all winners. And if you'll please return to the stage area, we'll remind you of that again at the end, because I know you'll be excited about being in it. I would be remiss if I did not thank our Colonel Sweat High School theatrical program for the beautiful decorations that they provided. As you entered the lobby, you probably saw beautiful clock decorations. Those were done by our Colonel Sweat High School through our collaboration with the public schools of Robeson County. And we really thank them. What a talented group of you. I had the privilege of meeting a young lady today that I've heard about for the past 2.5 years. She is the daughter of Sheree Jones, who works with the Community Health Services Department. Miss Drianna Jones, and she is going to provide our entertainment for us tonight. Drianna will be singing for us When We Were Young by Adele. I'll tell you a little bit about Drianna. She is a senior at Hope County High School, and her hobbies and interests include singing and dancing for MMB, which is the Mighty Marching Bucks. Drianna aspires to be an interior designer, and she is just a very beautiful young lady. I can see what her mom has been bragging about, and I know why she's so proud. So at this time, Miss Drianna Jones.
Everybody loves the things you do.
who is our coordinator of pastoral care, to join us to present the Compassion for You Churches and Partners category.
Good evening. I'm Reverend Dean Carter. I want to say good evening, church. How about that? Now, I hear you. Somebody's got to shout amen. Otherwise, I'm going to cry out. I'm the coordinator for the Department of Pastoral Care at Southeastern Health, coordinator for Compassion for You Congregational Wellness Network. Reading from the scriptures that I hold as my truth from Deuteronomy, it says, "This day I call the heavens and the earth as witnesses, that I have set before you life and death, blessings and curses." And it says, "Now choose life, so that you and your children may live, and that you may love the Lord your God, listen to his voice, and hold fast to him. For the Lord is your life, and he will give you many years in the land he swore to give to your fathers, Abraham, Isaac, and Jacob." May God bless the reading of his word. In recent years, at these same Southeastern Community Health Awards, we started a tradition by recognizing the inaugural churches who signed a covenant of agreement for participation in the Compassion for You Congregational Wellness Network. Compassion for You is the pilot project to show the impact of faith health networking. And notice I did not separate those two words. Faith health networking, the groundbreaking effort in trying to use faith tools to impact chronic disease conditions and social problems in a county like Robeson that is listed among the bottom 10 in all of the United States in health and in financial disparity. And we are proud that this initiative is being adapted to the culture of Robeson County and the surrounding region, and is gaining state, national, and in one case even international attention in the medical journals for our success. Our effort is entitled Compassion for You Congregational Wellness Network. It is a network of congregations focused on creating an epidemic of health by meshing faith tools and resources with evidence-based wellness education and techniques. That's a mouthful and a big undertaking, but we're seeing some success. Tonight, we begin by honoring churches that have signed a covenant agreement within the past year and have enjoined the work of wellness with the agencies that comprise Compassion for You. The churches will receive a framed covenant over by Alicia for display in their respective houses of worship. The covenant is reflective of the commitment made by the church, the Compassion for You partner agencies, and Southeastern Health to make an impact on individual and corporate health by addressing wellness lifestyle changes. This brings to the network now a total of 18 churches. The latest church to sign was actually Mill Branch Baptist Church, who is not represented tonight because that signing was so recent after our planning was completed. We welcome them. I hope some of them aren't here tonight, but we will formally recognize them at next year's event. I'm going to ask that our representatives from the two churches approach the stage to receive the covenant. Would you come? Calling in alphabetical order our newest Compassion for You Congregational Wellness Network covenant churches are First McDonald Baptist Church, represented by Reverend James Rice. Would you step forward? The co-pastors are Reverend James Rice and myself, Reverend Dean Carter. McDonald Baptist Church has done an outstanding job of connecting with the small crossroads community and the town council for the town of McDonald municipality on common core health concerns. McDonald Baptist Church, in cooperation with the McDonald Town Council, sponsored the first ever Compassion for You CPR AED training event. And that means hands-only cardiopulmonary resuscitation and training for the use of a town-owned automated external defibrillator. It was given to 26 persons, all receiving Red Cross certification cards. The course was led by a Covenant partner in Robeson County EMS, trainer Mike Pate and assistant Tammy Taylor. 12 of the 26 were Spanish-speaking only, accommodated for bilingual translation by Southeastern interpreter Rosa Locklear. It's a great example of small population churches doing tremendous deeds of wellness impact on a surrounding community. Would you congratulate McDonald Baptist Church? Next is St. James AME Zion Church in Red Springs. Would you step forward? The pastor is Reverend Sharon Mitchell, and the church care coordinator is Sharoya Breeden. St. James AME Zion Church joined Compassion for You this spring and was immediately asked to participate in our community health needs assessment. Besides learning the basic education unit of Compassion for You, St. James also was asked to name individuals to participate in a Red Springs focus group for the UNC Center for Diabetic Translation and Research regarding the benefits of the Mediterranean diet. We anticipate a great example from this church as to how faith and health should be intertwined for wellness. Would you congratulate?
Good evening. I'm Alicia Oxendine, Director of Guest Services for Southeastern Health, and I have the privilege this evening of recognizing and recognizing our Congregational Wellness Network partners. Our family grant agreement stated that we would partner with an anchor hospital with a minimum of 2 local healthcare safety net agencies. Today, Compassion for You Congregational Wellness Network actually boasts of 14 covenant agencies working at various levels of community outreach to improve the health of our citizens and to teach wellness lifestyle changes. We are using the forum tonight to recognize 4 of our newest agencies that have signed the displayed Covenant of Shared Commitments as covenant agency partners. A 5th agency, the North Carolina Medicine Program, has signed as recently as October 12th, and we will recognize them at next year's event. However, we are so very grateful to partner with them, and we look forward to our collaboration this year. Would the honorees come to the stage and be recognized in partnership, please? Our newest Compassion for You Congregational Wellness Network Covenant Agency partners, and we'll start in alphabetical order, please. Campbell University, Jerry M. Wallace School of Medicine, recognizing Dr. John Kaufman and Reverend Doug Short. Would you step forward? The mission of Campbell University School of Osteopathic Medicine is to educate and prepare community-based osteopathic physicians in a Christian environment to care for the rural and underserved populations in North Carolina, the Southeastern United States, and the nation. Our outstanding biomedical and clinical faculty prepares students to be lifelong learners and excellent practitioners. Medical students are being given the opportunities to participate in Compassion for You events, such as health fairs, screenings, and camp care bereavement events for children. And we recognize you this evening. Robeson County Public Health Nurse Family Partnership, recognizing Darlene Gold, Supervisor. The Nurse Family Partnership NFP, is a nonprofit organization operating in Robeson County, which arranges for home visits from registered nurses to low-income first-time mothers. The visits begin during pregnancy and continue for 2 years following birth. NFP intervention has been associated with improvements in maternal health, child health, and economic security. NFP partnership with Compassion for You was created by a common relationship with the Kate P. Reynolds Charitable Trust in dealing with the impact of these families of Hurricane Matthew. Would you give them a hand? Give her a hand of applause. Our third agency partner, Southeastern Pharmacy Outreach, recognizing Dr. Lakeisha Love, manager. Southeastern Pharmacy Outreach was asked for professional commitment during the North Carolina MedAssist event held January 27th of this year. Pharmacy counseling and oversight was made available to recipients of $100,000 worth of over-the-counter medications at an event that set a state record for numbers of people served. 1,741 persons received most of their choices of OTC medications, equaling to about $80 to $100 value for each individual that attended. A second medication giveaway event is in the planning stage, and we will again seek this commitment, and we're so very proud of this organization. Let's give them a hand of applause, please. Our fourth covenant agency partner, Southeastern Psychiatry Clinic. Mr. Anthony Grimaldi, director of the Southeastern Psychiatry Clinic, seeks to improve the overall lives of behavioral health patients in our region by medication case management, psychotherapy, and improvement in clinical compliance. A particular interest in the effort is the focus on diabetes behavioral health parallel. Provision is being made to improve compliance through psychiatry and pharmacy care clinics, including transportation to and from as needed. Behavioral health first aid is a course being offered by Grimaldi through Compassion for You to professionals, students, civic groups, and churches to improve the lives of those patients and families who are afflicted with behavioral health-related challenges. And we recognize you, Anthony, for your work. Thank you, and let's give him a hand. Reverend Carla.
In very brief closing, I'd like to pray. Would you bow your heads with me, please? May God add blessings to each of these individual congregational and institutional efforts to better the health of all the beloved of creation. Praise be to God for all of the opportunities that become good outcomes for a community that dares to join the power of faith with the efforts to create better health. We leave you all with these two of the most often repeated statements in all of Scripture as our encouragement and closing. First, fear not, for lo, I am with you, and your faith has made you well. Amen. I'd like to invite to the podium our Vice President and CEO of Chief Operating Officer, Mr. Jason Thomas.
All right. Well, good evening. It is my great privilege to present tonight's faith-based awards. So I'd like this time to invite the nominees up for the faith-based category to join me here on stage. Please, as I call your name, please step forward. The nominees for the faith-based award are Antioch Baptist Church. Antioch hosted Camp Care Bereavement Camp in 2017, serving many children who had lost a loved one. Carla and Redemption Ministries. The group has helped to educate the community about the dangers of heart disease and obesity by living the example. Rosemarie Glenn, for faithfully providing spiritual and physical nourishment to our community. St. Matthew's AME Zion Church. They have hosted numerous congregational and community health events, such as the 2nd Annual Maxton Health and Wellness Fair, Faithful Families Eating Smart, and Moving More, and have launched a community garden. So, without further ado, if I can get the envelope open, the winner is Rosemarie Glenn. At this time, I'd like to invite David Sumner, Vice President of Corporate Services and our Chief Strategy Officer, to present the Business Award.
Good evening, and thank you, Jason. I do have the distinct privilege tonight to present the Business Award to this group, and I would like to ask the nominees for the Business Award category to join me on the stage at this time. I would ask that as your name is called, please step forward to be recognized. The nominees for the Business Award are Biggs Park Mall, and I understand they're not able to join us tonight, but let me describe to you a little bit about Biggs Park Mall. Chelsea Biggs and her father, Kenny, along with the Biggs Park Mall security and maintenance staff, are always willing to lend a helping hand to support any ongoing partnership with Southeastern Health. Thank you, Biggs Park Mall. Carolina Surf and Turf. Carolina Surf and Turf Market provided and prepared fresh local food for first responders during Hurricane Matthew. Thank you, Carolina Surf and Turf. Clean Eats. Clean Eats has brought much needed healthy eating options to our region through their partnership with Southeastern Health's Fitness Services. Thank you, Clean Eats. Southeastern Health. Southeastern Health contributed to the betterment of the community by feeding individuals in the cafeteria, dispensing meds when pharmacies were closed, and sending providers to shelters during and after Hurricane Matthew. Thank you, Southeastern Health. Summer Camp, Sapp Recreation Center. This center provides great hope and guidance for many who simply need a helping hand in confidence and skill building. Thank you, Summer Camp, Sapp Recreation Center. And this year's winner of the Business Award is, we got these pretty secure here. No sneak peek, and the winner is Sapp Summer Recreation Camp. Congratulations. Give all of our business nominees at the podium. At this point, I would like to turn the podium over and introduce Ms. Renee Taylor. She's our Chief Nursing Officer to present the Community Education Emergency Support Award. Renee?
Good evening. I would like to invite the nominees for the Community Education and Emergency Support category to join me on the stage. forward when your name is called. The nominees for the Community Education and Emergency Support Award are the CHEC Center, Community Health Education Center. They have gathered the community together with its various offerings of free education, food, and resources to improve the health of the community. Kiwanis of Robeson, Lumberton. Kiwanis Club raised and dispersed over $20,000 last year to approximately 15 community organizations in Robeson County to be used for enrichment activities for youth in the county. Carla Monds. Carla was able to secure an emergency grant for $5,000 to provide Christmas gifts for HIV victims affected by Hurricane Matthew. Robeson County Center of the North Carolina Cooperative Extension. Through their work in the schools and with limited resource adults, thousands of Robeson County citizens are able to eat healthy, on a budget, and prolong their lifespan of their families. Robeson County Sexual Violence Prevention Task Force, Rape Crisis Center of Robeson County. They have undertaken a variety of projects with the goal of creating a safer environment for all, to include the creation of a handbook and resource manual for parents and caregivers of people with disabilities focused on healthy sexual development and prevention of sexual abuse. School nurses, Public Schools of Robeson County, for promoting a safe and healthy school environment and ensuring that students have met all immunization requirements to enter a public school system. And the winner is the North Carolina Cooperative Extension in Robeson County Center. Our Vice President of Finance and Chief Financial Officer, to present the Government Award.
Thank you, Renee, and good evening. All right, so it is my privilege tonight to recognize our Government Award nominees, and in keeping with the same process, if our nominees would please come to the stage. If you would just step forward as I call out your name so that you can be recognized. First is Representative Garland Pierce. Representative Pierce and members of the committee hosted an annual Day of Caring for seniors, which allows them access to a healthy holiday meal and free screening provided by local health agencies. Thank you, Garland. Sheriff Kenneth Seeley. Sheriff Kenneth Seeley is being recognized for bringing staff supplies and assistance with coordination and deliverables throughout the Hurricane Matthew event. Thank you. And Senator Daniel Britt, which you will be representing. Thank you for being here.
I just watched it.
He is being recognized for establishing several emergency shelters and donation efforts during and after Hurricane Matthew. All three individuals are certainly in position to receive this award, but only one will, and we are going to give it to Representative Garland Pierce. All right, with that, I would like to turn over the presentation to Dr. Joseph Roberts, who is our Vice President of Medical Affairs. And he will present the Healthcare Provider Award.
Thank you, Thomas. Good evening. I'd like to invite the nominees for the Healthcare Provider category to join me on the stage. Please step forward when your name is called. The nominees for the Healthcare Provider Award are Catherine "Cat" Yanes, PAC. Cat researched the opportunity and successfully applied to the Breast Cancer and Cervical Control Program, BCCP, for grant funds for low-income women to receive mammograms. And cancer was detected in 7 women. Thank you for that, Cat. Anthony Grimaldi and Dora Hines. Anthony and Dora have worked to create a transportation system for behavioral health patients, allowing them access to doctor's appointments. Thank you. We have the Brian White program, Robeson Healthcare Corporation, for assisting HIV patients with every aspect of care so that they may focus on their health. Thank you very much. And last but not least, Dr. Danny West, for taking the time and making the effort to ensure his patients understand their health issues. And the winner is, I vote for mine beforehand. Dr. Danny West. Hammonds, Director of Community Health Services, to present the Individual Impact Award.
I would like to invite the nominees for the Individual Impact category to join me on stage. Step forward when your name is called. The nominees for the Individual Impact Award are Mr. Joshua Freeman, nurse practitioner, for ensuring his patients get exactly what they need prior to, during, and after surgery. Thank you. Mr. Harry Grayer, for the establishment of the Mary and Thomas Grayer Hospice Volunteer Endowment, which will assist Southeastern hospice volunteers with educational materials, supplies, and food for scheduled meetings. Mr. Ronald Hammonds, for offering free educational tours to the kids at his farm and believing in helping the younger generation by teaching them a greater understanding of nutrition and agribusiness. Thank you. Mr. Jay Leggett, for helping facilitate an over-the-counter medicine giveaway in November 2016, along with the Kate B. Reynolds Charitable Trust, Southeastern Health Pharmacy Director Eric Locklear, and many others. Thank you, Jay. Ms. Anna Madison, for continually going above and beyond to contribute to the better health of the community by collaborating with the Community Health Education Center to educate patrons about diabetes management through better food choices. Thank you, Anna. And Ms. Joyce Patterson for her involvement with the Mayor's Committee for the Challenge, the Special Olympics, Special Needs and Senior Citizens Day, Backpack Pals, and the United Way Day of Caring. Thank you. And the winner is Mr. Ronald Hammonds. I would now like to introduce Lori Dove, Vice President of Post-Acute Services and Chief Continuum of Care Officer, to present the Eye of the Storm report.
Good evening. In reflection of the dedication and hard work and sacrifices made last year after Hurricane Matthew, please join me in watching a brief video of recognition to our hurricane heroes.
but I see it in you, so we can walk it out. Ooh, my day, we can walk it out. Ooh, all day. And I'll rise up, I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I'll do it 1,000 times again. When the silence is quiet, and it feels like it's getting hard to breathe, and I know you feel like dying, but I promise we'll take the world to its feet. Mountains, bring it to its feet. Mountains. And I'll rise up, I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I'll do it 1,000 times again.
To serve one another and to care for one another as only we can do for each other. And as the name of this category, the eye of the storm, reflects, in the eye of this storm, he did remain in control. As we call out each of the groups, if you will come forward and receive your award, and then stay right here on this side of the stage until we're complete, we'll get a group picture. Everybody here in this category will receive a reward, as they should, for being our hurricane heroes. So our first group is our Baptist men for coming to the aid of Robeson County citizens after the flood and providing construction services at no charge to help repair homes. And I know they couldn't be with us tonight, but we'll make sure that they get their award. Pastor Shedrick Bird. Okay. But through Pastor Bird's connections and resources from various places, many families were able to get the necessary items to survive during and after Hurricane Matthew. Thank you. If you'll come this way, we'll give you the award. Gary Locklear. Since Hurricane Matthew, Gary has worked with the United Methodist Church Emergency Relief Team to rehabilitate homes in Robeson County that were destroyed by the storm. Lumberton Rescue, for working tirelessly during and after Hurricane Matthew to save the lives of many individuals and then later to recover loved ones. Thank you. The North Carolina Conference of United Methodist Church Disaster Response Teams. And as of May 2017, about 6,000 volunteers representing about 600 work teams had offered to help to mitigate the losses of those affected by Hurricane Matthew. New Hope United Methodist Church, for ensuring that victims of Hurricane Matthew had shelter, electricity, hot meals, and were able to bathe during this time of crisis. And West Lumberton Baptist Church, after being completely flooded from Hurricane Matthew, the church cared for the community for providing health and hygiene products, food, and household supplies during this time. So help me, join me with a group, recognizing this group one last time. Step this way, and we'll get your pictures. Thank you. At this time, I would now like to ask Joanne Anderson, our President and CEO, to present our Lifetime and Beacon of Hope awards. Thank you.
I get the privilege tonight of recognizing 3 people who have made significant contributions to this community throughout their lives here in Robeson County. These are individuals who many times didn't think of themselves at all as they went about their day-to-day activities. They were not thinking that at some point in time somebody's going to give me an award for doing what I do just naturally. And for each one of them, they have impacted the lives of not hundreds, but thousands of people throughout their lives. The first person that I would like to recognize is the award for Lifetime Commitment. And this individual is someone that I've known since I came to Robeson County about 10.5 years ago, and if I were going to put a crown on somebody and say, this is Mr. Robeson County, it would be Richard Monroe. Richard here? Yes. Richard, come forward, please. I'm calling your name. So I'm going to talk about Richard as he walks forward. Richard is someone that if you're out and about in Robeson County, you're probably going to see Richard there if anything's going on. Richard is a former teacher for the public schools of Robeson County. It's my understanding he taught in our school system for 28 years. He also served as the Human Resources Specialist for the public schools of Robeson County. He was named Teacher of the Year 7 times during his teaching career. Imagine the students that he impacted during that time frame. He was nominated and was first runner-up for Teacher of the Year for North Carolina one year. Richard has served as the president of the Robeson Community College Faculty Association, the president of the Robeson County History Museum. He's been on the board of CIX. He's on the Robeson County Arts Council. And most recently, his efforts have really been centered around Lumberton. He is the chairman of the Rediscover Downtown Lumberton initiative. He and the Rediscover Downtown Lumberton group have come together and actually worked very closely with the city to imagine what Lumberton could be. If you drive down Lumberton today, there are many empty buildings there, but there's a lot of potential there. And Richard and the group of Rediscover Downtown Lumberton individuals have really created a vision for what Lumberton can be reinvented into. They worked with the city to develop a master plan. That master plan is being executed as we speak. There are individual steps that have been identified that will take place over the next several years. And I think let's give it 5 years, and in 5 years you're going to see a new Lumberton downtown. Things like the stage that's down there today, new signage that's appearing in downtown Lumberton, a lot of the cleanup that's occurred in downtown Lumberton has been through the leadership of Richard Monroe. Richard, we thank you for your commitment to not only Lumberton, but to Robeson County, its history, and also its future. Congratulations.
I am so honored and so humbled to receive this award when I think about so many people in Lumberton and in Robeson County do so much to make this a wonderful place to live. And all I ask is that in the future, you join me and others in making this the greatest place in North Carolina. Thank you.
The next award I'd like to give is for Lifetime Achievement. And this individual really doesn't need me to introduce him to you at all. If you've ever had surgery in the past in Lumberton at Southeastern Regional Medical Center, at least since 1953, you might have had surgery by this gentleman, Dr. D.E. Ward. Dr. Ward, could you come forward, please? Dr. Ward's coming forward. I'd like to just tell you a little bit about him. I came to Robeson about 10.5 years ago, and one of the first people I met was Dr. Ward. He was in the hallway of Southeastern Medical Center, and he came up to me and he introduced himself. And he told me that he had been at the hospital for over 50 years. And I said, oh my goodness. And he said, now listen. At some point, I'm going to quit. I'm going to quit practicing, but I'm still practicing today. But I want to assure you, I don't do anything that's going to hurt anybody. The second thing is, when I do decide to quit, I don't need a party. I don't need any recognition. Mr. Welch, when he was here, he gave me a big party. I don't know if he was hoping I was going to retire then or what. But I decided to take the party and keep working. This is one of the smartest men I know. If you talk to him about anything, he is right on point. He can talk to you about the history of not only Robeson County, but the history of North Carolina, trains and aviation. He's an avid member of the Lumberton Rotary Club, very active in that club. But if you just think about what Dr. Ward has given to this community and the number of people that he's impacted through his service, through his surgical practice, that in and of itself, I think, is deserving of this award. But I want to read you a few things about Dr. Ward and what he's done outside that arena of just practicing in his office. He was a member of the inaugural staff of Southeastern Regional Medical Center. Imagine that. He helped start the hospital and where we are today. He has served as the president of the medical staff there. He's been the coordinator of the community medicine preceptorship and for the Bowen Gray School of Medicine. Hundreds of students have gone through Southeastern Regional Medical Center because he coordinated the efforts to get them there. Imagine what those doctors are doing today because of the start that they got here because of this man and the lives that they're impacting today. He's had 11 articles published in various journals from 1945 until 1981. In 1989, he was named the Physician of the Year by the County Medical Society. He served as the president of the North Carolina Medical Society. He served as the president of the North Carolina Division of the American Cancer Society. He's the past president of the Wake Forest University Alumni Association and the Wake Forest School of Medicine. Senator David Weinstein at one point said, "He is not only a husband, father, deacon, physician, and community servant. He is an example of all that is good in our state." He said that at the time that Dr. Ward was awarded the Long-Leaf Honor. When you think of this man and what he has contributed to our community, there's probably story after story after story. But behind each one of those stories are people. Dr. Ward, in the 10.5 years that I've known him, always puts people first. His mission is to make sure that the people are cared for. And I've never run into him anywhere, even if it's the grocery store, or Rotary Club, or in a medical staff meeting, where he didn't have a kind word to say and a smile on his face. And most of the time, he had a positive message about Lumberton and Robeson County. Congratulations, Dr. Ward.
Well, this is certainly a surprise. I'm honored and privileged, and I certainly want to thank the good Lord for giving me health and longevity so that I could be here at 96. I want to thank my family, my mother and father in Durham, my good wife of 72 years this month. For her, I wouldn't be here now, I'll tell you that. And I want to thank Southeastern Health for this honor. Thank you very much.
And yes, he did say 96 years old. Truly an amazing man. The last award I had to bestow tonight is called the Beacon of Hope. And this is a new award for us this year. We've not presented this in the past, but you know, when we looked at tonight's awards and we thought about the theme of it's time for a change, many times we don't really look at some of our circumstances and say, I can change that. I can make a difference in that. I'm willing to take on that challenge. There are certain populations and certain situations that we often shy away from as human beings. But the individual tonight that is going to receive the Beacon of Hope has not only shied away, but has actually run to situations that many of us would have avoided at all cost. I'd like to call Carla Monds to the stage. Tonight, you've seen her up here before. She's kind of a repeat performer tonight. And as we were looking at the nominees for this year, Carla's name came up in so many different categories that we had to take a pause and say, what is this woman doing? That so many different people under so many different categories would think, I need to recognize her and the efforts that she's making. See, Carla works for a population that many of us, like I said, would avoid if we could. The HIV population is not one that people seek out. But Carla has embraced people with HIV and AIDS. And she said that that's my mission. I'm going to make sure that they're not forgotten, that they have resources available to them, and that they're supported in the journey that they're on. She works for Robeson Healthcare Corporation, and they support her in that. They don't make her do it. She has chosen to do that. I think God has prepared her to do that. And she makes a difference every day in the lives of, while we may think it may be just a few people, but if it's one person that she can give hope to through her efforts, she has truly been the beacon of hope. for that one individual. Carla, congratulations.
Thank you so much for this tonight. I sure didn't expect it. I kept a revolving door coming up that I didn't expect to receive. But I do give God the glory and the honor for allowing me to continue my education so that I can be in this position. I want to thank God for the team at Robeson Healthcare, my Ryan White crew. I think they're all gone now, except for April. April Leake's still back there. Thank the Lord for all the hard work that they do. Dr. Robin Peace is here today, and we thank her so much for all that she does. Jennifer McLam is here representing our company tonight. And I want to thank God for my mother, Miss Helen Oxendine, on the front row, my husband, Mr. Earl Monds, and my daughter Kyla. My son Jordan couldn't be here tonight. My Aunt Betty is here as well, Betty Groington. And my mom has taught me everything I know about compassion, and I give all the glory to God. Thank you so much. God bless you.
I started tonight by saying that we have a value statement at Southeastern Health that says we pursue positive change. The theme for tonight is it's about change. It's time for change. Each one of the people who were nominated this year sought change. They saw an opportunity, they saw a need, and recognized that they had the ability, the desire, and the drive to make that change. I'm going to challenge each one of you tonight to think about what could you change. When we look at Robeson County, on a statewide basis, there are 100 counties in North Carolina. When we look at the health status indicators for our county, unfortunately, Robeson County ranks at the very bottom. We're number 100 out of 100. Tonight's recognition of these individuals are people who are trying to change that number. And it's not about the number, it's the people behind that number. When you think about healthy living, health status indicators, we heard tonight about people who are addressing HIV or diabetes or heart disease or providing care to populations that otherwise wouldn't have it. They're about changing that dynamic and that number. We have the opportunity to say Robeson County can be better tomorrow than we were today. You know, a few weeks ago I sat with a group of people and they were talking about, unfortunately, a negative incident that happened in Robeson County. And they related to us that they talked to some people about the experience that they'd had. The people they talked to kind of went, "That's where I go." It was almost as though we accept that negative things are going to happen in Robeson County. They don't have to. And if they do, we don't have to talk about it. And we don't have to share with other people, well, that's just the way we are, as though we don't have the opportunity to make a difference. Every one of those people sitting over there said, we're going to make a difference. I'm proud of this team up here because every day they walk through the doors of Southeastern Health and say, we're here to make a difference. But Robeson County has to step back and say, we want to make a difference. We want to square our shoulders up and stick our chest out and be proud that it's Robeson County. Not throw our hands up and roll our eyes and say, that's Robeson County. That's the way we are. Until we change that attitude, Robeson County will remain 100 out of 100. What you heard tonight was about attempts to make wellness a culture in our community. It starts first with each one of us. It starts with our moms teaching us how to be a good person and to live a good life. It's about our heart. It's about our body. It's about our spirit. It's about our mind. You know, for a person to be well, it takes all of that added together to be in a good place. If one of those is out of kilter, we're not where we need to be. And if we're challenging each other and saying negative things or approaching things from a negative perspective or making negative comments about another person or not appreciating the differences we bring to the table, we're only tearing ourselves down instead of building ourselves up. When I came to Robeson 10.5 years ago, I was told we have a very diverse community. And we do. But I think that's a good thing. But we can't let that diversity separate us. When you looked at that video earlier about Hurricane Matthew, nothing separated us. It wasn't the color of our skin, it wasn't the money we made, it wasn't the title that we had. There was a need, we saw it, we did what we needed to do, and we made it better. For the good of the whole. I think that's the spirit we need to have every day. It doesn't matter who we are, or what position we hold, or where we live. Hurricane Matthew forced us to change. We are a different community today because of what happened on October 8th of last year. We were a different community on October 9th last year because a lot of barriers were broken down. People just saw people instead of differences. Tonight's about change, positive change. I encourage each of you to go out tomorrow and start your positive change, whether that's as an individual yourself, the people around you, or the entire community. We have the ability to do it, but we got to take that first step. I am so excited about the number of people that we have nominated this year. Some years we have to really grapple to get nominations to come in, and this year they flowed. That's a byproduct of the change that Hurricane Matthew created last year. Let's not lose that momentum. I didn't want this auditorium filled up next year because good things are happening in Robeson County. And at the end of that, we can say, this is Robeson County. Thank you all for being here tonight. I want to remind the winners of each of the categories, if you would come forward so we could get a group photo, we would appreciate that. If you come back over to the side of the stage over here, and then we'll let you go. Safe travels to each one of you. Thank you.